Hello. I hope you can hear me. Please tell us where you're watching us from, and it's good to see you. I know this is pretty sudden. Some of you are probably about to have lunch, but then I thought we can, I have a bit of time on my hands, so I thought let's chat a bit about diabetes. I know that I must apologize. We didn't give you prior warning that we were going live, but then, sometimes when you have an opportunity, you grab it. So I had a bit of free time, so I thought, you know what, let's chat a bit. So here's a thought I want to leave with you for this year. Let me first of all switch off this thing. It's making a bit of noise. Here's a thought I want to share with you for this year for your health and also maybe for the health of your loved ones as well. Pay attention because if there's something that we sometimes don't really pay attention to, it's this thing called diabetes. Because part of the reason is because in most cases, one would be walking around with diabetes and they probably don't even know, or one would be walking around with very high risk for diabetes and they don't even know that they're at high risk of developing diabetes. Now, if you notice that, for example, that you feel very tired, like you feel tired and your fatigue is unexplained. You have what we call lassitude, or you wake up in the morning or in the middle of the day or in the evening, you feel really, really tired, like unduly tired. It's possible that you could be diabetic. It's possible that your sugar is very high, and that's probably why you're feeling that way. Um, and you know that in adults, diabetes is mainly like type 2, and that type of diabetes, we actually acquire it as we go through life. And what puts us at risk of diabetes is insulin resistance, which is as a result of the fat that we accumulate. The fat that should worry you the most is the fat that we accumulate around our bellies. So if you have belly fat, there's a good chance that you are at risk of developing diabetes, especially if there are people in your family who also had diabetes, then chances are that you could also uh, get diabetes because of that. So pay attention to such things. The other thing that may also put you at risk or probably make you start to think about could I or could I not have diabetes is if, for example, you are having you're getting thirsty too quickly, too much, and you find yourself drinking too much water. Not this water that we drink on this page. Like you just find yourself very thirsty most of the time, and you're drinking too much water. Or you're getting these chest infections from nowhere, and you keep getting them repeatedly. And also on top of that, you're overweight. Or you keep getting repeated urinary tract infections. You're getting urinary tract infections over and over and over again. Chances are you could be diabetic and you don't know. And probably you need to look into that as well. So one of the things you should do is probably, you know, say at the beginning of the year like this, if you can, get yourself checked for diabetes. It's very easy. It's a very simple procedure. Get yourself checked for diabetes. And as you get yourself checked for diabetes, let them also do your lipid panel or your cholesterol panel. Let them do that as well. And then and let them analyze it for you, especially if you have some of these risks I've talked about. You are a man and you notice that your erection is not that strong. Could it be that you're diabetic and you don't know? So there's that possibility as well. Now, the beauty about diabetes is that diabetes is very, very easy to control. It's a very controllable illness, and you will find that in the very, very early stages of diabetes, we generally don't rush to put you on treatment unless, of course, you have complications. But generally speaking, you will find that if it's type 2, your doctor will probably advise dietary changes, and if those dietary changes don't assist you, then we then move on to start putting you on medication. But the opportunity you have with type 2 diabetes is that if you manage to control your diet, you reduce your weight with exercise. I have seen patients, some of them we've managed them right here at CarePeak Specialist Clinic. who have even stopped, taking medication. Why? Because diet control and exercise helped them. But then these issues of diet control and exercise, you need to do them under supervision, meaning that your doctor needs to be able to manage your medication and manage your condition, even as you have that goal in mind. Because this doesn't work for everybody, but it's worth trying. It's really, really worth trying if you want to try that. All right. So that's the thought I thought I leave with you today. That bear in mind about diabetes, and should you feel that this is something you want to discuss further, contact your doctor. You can also contact us if you want. There's no problem. And allow us to take this opportunity to thank CarePick Specialist Clinic for bringing you this very short thought that we had. We may also see you tomorrow again with another thought. Please do take care. Enjoy your lunch.